often asked, what's the difference between liposuction, a tummy tuck, a mini tummy tuck? And really, the main differences are with liposuction, all we're doing is we're making very small incisions, 2 to 3 millimeters in diameter, which heal up very well. And we're only making room for us to put suction cannulas through those areas, placing in anesthetic fluid, or what people call tumescent fluid, allowing that to separate the fat, and then we suction the fat out. So that's liposuction alone. When we start to talk about tummy tucks, there's a few different types, but to kind of keep it simple, there are what we call a full abdominoplasty or a full tummy tuck. And what we're doing in that type of procedure very often is making an incision in the bikini area. And so that incision is well camouflaged by underwear and bathing suits. We lift up the skin and the fat over the muscle, over the abdominal muscles, all the way to a region above the belly button. And then while we have the muscles exposed, we take sutures and we sew those muscles together to create a corset effect. And then to complete the procedure, we often have to create a new belly button because we're pulling so much skin down that the place where the original belly button is going to be removed with the skin and fat. And so we make a new entry hole for the belly button, and that's a full abdominoplasty procedure. That type of procedure is most common in patients who, for females who get it done, who've had children, in which the stretching of the abdomen, specifically the muscles, by the child have caused those muscles to spread apart, those ab muscles. And so patients who have had children and who have either a midline bulge in addition to, they can kind of feel their abs on the side, those are the patients in whom a full abdominoplasty or tummy tuck will really help them get that flat tummy that they're looking for. A mini tummy tuck is another type of procedure that we often can do awake, as opposed to a full tummy tuck, which we normally do asleep. So in a mini tummy tuck, we're not necessarily changing the position of the belly button, and we are really taking out skin and fat tissue in an ellipse pattern, but all that skin that we're removing is from an area below the level of your native belly button. So that's a mini tummy tuck. That's great for patients who have a little bit of extra loose skin in that region, or want to get a tighter abdomen very quickly. That will help really speed up that process. Of course, it does involve an incision and sutures. The way I personally do it here at the Glow is the sutures are dissolvable, and so when you leave here, you just have a straight line with no visible sutures through the skin. They're all underneath the skin.